Good afternoon, everyone, and welcome to the Council of State Governments webinar series. Today's event, State Strategies to End Child Poverty as a Barrier to Educational Success, is a component of the 2014 Leaders Initiative focused on state pathways to prosperity. CSG President, Governor Earl Ray Tomblin of West Virginia, and our Chairman, Senator Mark Norris of Tennessee, are pledging their tenure to focus on workforce and education leading to economic prosperity in the state. I'm Pam Goins, the Director of Education Policy here at CSG. As your moderator, I want to welcome you and thank you for joining us on this call. A few logistical points for our listeners who are new to CSG's web conferences. Please note that this webinar is being recorded and will be posted to CSG's Knowledge Center shortly after the conclusion of the event. If you're listening over the phone but are not logged into the web portion of the event, refer to the registration instructions you received. This will help you access the slides that our panelists will use today. Currently, all participant lines are in listen-only mode. If you have a question for any panelist, you can access the question box at the bottom right portion of your screen. A recent report by Educational Testing Service found poor children completed 2 fewer years of school, earned less than half as much money, worked 451 fewer hours per year, received $826 per year more in food stamps, and were nearly 3 times as likely to have poor health compared to children whose families had incomes of at least twice the poverty level during their early childhood. Among the world's 35 richest countries, the United States ranks second highest in the rate of child poverty. Achievement gaps between the poor and the non-poor are twice as large as the achievement gap between black and white students. Today's webinar will showcase ways state policymakers can utilize their role to reduce the impact of child poverty on educational success. Let me introduce our expert panelists for today's webinar. Dr. Kristen Moore, Dr. Ron Haskins. Unfortunately, our third speaker, Senator John Unger from West Virginia, has been called to the floor on the Senate and will not be able to be with us today. Our first speaker is Dr. Kristen Moore. She's a senior scholar and co-director for youth development at Child Trends. Dr. Moore leads the Youth Development Research Area at Child Trends, where she studies trends in child and family well-being, adolescent development, effective programs and practices, the determinants and consequences of adolescent parenthood, the effects of poverty and welfare on children, and positive development. She was the founding chair of the Effective Programs and Research Task Force for the National Campaign to Prevent Teen and Unplanned Pregnancy. And from 1998 to 2003, Moore served as a member of the National Advisory Council on the National Institute of Child Health and Human Development. Dr. Moore, we'll turn the presentation to you.
Thank you. Thank you very much, and thank you for providing this opportunity for me to talk with you all today. This is certainly an important topic and one that Child Trends has been working on for most of our 30-year history. Next slide. My talk will focus on 5 discussion topics. First, a very quick overview of Child Trends, a walk through child poverty by the numbers, a discussion of how poverty harms children, what we know about poverty and educational outcomes, and then several policy considerations. Next slide, please. So Child Trends is a nonprofit, nonpartisan research center that focuses exclusively on children and youth issues. Our work helps inform, we hope, practitioners and policymakers on such issues as early childhood education, poverty, child welfare, teen pregnancy, and youth development. We have a staff of more than 80 in the Washington area, where I am, and in Minneapolis and Research Triangle area of North Carolina. Next slide, turning to child poverty. I suspect this is a familiar slide. The poverty among children remains high. And you can see that we have not made much progress since the 1960s. Next slide shows the trends for other age groups, and you can see the effect of the recession, but the top line is of interest as well, and it shows the trend in poverty among young adults, 18 to 24. And you'll see that that is also high. It's about as high as it is among younger children, and certainly has gone up during the recession, whereas the line for people 65 and older has actually shows a decline in poverty over the course of the recession And in red is the main working age population, which is much lower, but did go up during the recession. The recession being the bar that is shown in gray. Next slide. It is the case that children are more often poor than older adults, but within the child population, younger children are more often poor. You can see that the red line shows poverty for children 5 to 17, and the higher line in blue is children under the age of 5. And one of the reasons that younger children are poor is that their parents are younger, and therefore they are more exposed to poverty. Next slide. In addition, poverty varies by race ethnicity, with blacks and whites about 3 times as likely to be, blacks and Hispanics about 3 times as likely to be poor as whites, and almost 3 times as likely to be poor as Asians. Next slide. And this slide shows poverty rates overall for states in the South. And as you will see, poverty rates compared with the United States as a whole, shown in the bar at the very bottom, 15.3%, is much higher across all of the southern region. Next slide. So turning now to 5 ways that poverty harms children. First, poverty harms the brain and other body systems. Gets under the skin. Poverty can negatively affect how the body and the mind develop and alter the fundamental architecture of the brain. And I think we've known for a long time that poverty makes a difference in the present, but it also makes a difference in the future because it alters the architecture of the brain. We know that children who experience poverty have an increased likelihood for numerous chronic illnesses, such as substance abuse and poor physical health. And these conditions can extend into adulthood. Children facing poverty also can have a shortened life expectancy. Next slide, please. Second, poverty leads to poor physical, emotional, and behavioral health, as I alluded to in the first point. Poverty works in multiple ways to constrict children's opportunities and expose them to threats to well-being. Poor children are more likely to lack food security, the expectation of a regular food supply, as well they have diets that are deficient in important nutrients. Rates of several chronic conditions, such as asthma, are higher among poor children, and they're also less likely to receive preventive medical and dental care. Next slide. And poor children are often stuck in neighborhoods with concentrated poverty, which is not good for them. It's hard to identify the direct causal links between neighborhood poverty and children's outcomes. That's challenging to researchers. But scholars have found that growing up in neighborhoods with concentrated poverty is associated with negative academic outcomes, more social and behavioral problems, and poor health and fitness. Poor children are more likely to live in neighborhoods where they're exposed to environmental toxins and also other physical hazards, which include crime and violence. In the case of violence, even indirect exposure, witnessing or simply hearing of its occurrence, has been linked with adverse developmental outcomes. Poor children are also disproportionately likely to attend schools in districts with fewer resources, with facilities that can be grossly inadequate, and with school leadership that is more transient. Next slide. So fourth, poverty can harm children through the negative effects it has on their families and on their home environment. While the strengths of poor families are often overlooked, parents experience numerous challenges that can affect their own emotional well-being as well as their children's. Poor parents report higher stress, aggravation, and depressive symptoms than do higher income parents. Parents with scarce economic resources face difficulty planning, preparing, and providing for their family's material needs. Also, children in poor families have fewer books and other educational resources at home, and they're less likely to experience family outings, activities, and programs, the kinds of things that enrich their learning opportunities. And their families are more likely to experience housing instability. Direct evidence that additional income can improve children's lives comes from several experimental evaluations. Programs that increase family income show improvements in children's social and academic outcomes. And next slide. So fifth, poverty creates and widens early achievement gaps. And this is very relevant to the topic today. Researchers have found that children growing up in poverty, when compared to their economically more secure peers, fall behind early in life. Starting in infancy, gaps are evident in key aspects of learning, knowledge, and socio-emotional development. When left unaddressed, these early gaps become progressively wider. Early optimal development tends to open doors to further optimal development, while impoverished development tends to close those doors. Poor children lag behind their peers at entry into kindergarten, in reading ability at the end of third grade, in the important self-monitoring skills often called executive functioning, and in school attendance in 8th grade. Because of all this, poor children are more likely to drop out of school or fail to obtain post-secondary education. Well, next slide turns to some policy considerations. And Child Trends is a nonpartisan organization, as I mentioned, and as such, we only offer policy implications and considerations that are based on research and evidence. So there are a few points that I would make here. We know research has shown that increasing family income can improve outcomes for children. We'll leave it to the economists and the policymakers to determine the best ways to do this. The current focus on income inequality and the significant and sustained levels of poverty in this country merits attention from these researchers, from policymakers, please. Second, Child Trends has just finished a comprehensive review of research on so-called integrated student supports. These are models operating in close to 3,000 schools nationwide that provide at-risk children and youth with both academic and, importantly, non-academic wraparound services. We will formally announce these findings next Tuesday. What I can tell you today is that there is promising evidence that these integrated student support programs can contribute to student academic progress as measured by grade promotion, credit completion, math achievement, and overall GPA scores. It is an emerging evidence base, but it is quite promising. Also, there is consistent research that high-quality early childhood education improves outcomes for at-risk children. This is a topic under great discussion at the state and national levels. Both academics and economists have reported on the benefits of investing in early childhood education, particularly for at-risk young children. If you're interested in looking at a range of policy options in this area, Child Trends published a full report on this late last year that is available on the Child Trends website. Next slide. The value of family support. Whenever we talk about education, we always need to remember the importance of the family and work to strengthen family supports. The family is the first developmental context for children. It provides material, social, and emotional support for children. Poverty, low parental education, and stress can compromise the quality of family relationships and the child's involvement in experiences that enrich development. So, family support programs can act to increase family engagement and parents' knowledge of child development, and then reduce stress, provide work supports, and help them access health and nutrition services, job training, or treatment for substance abuse. Next slide. And here are some examples of policy choices that might support families. Voluntary evidence-based home visiting for new and expectant mothers at risk for negative child outcomes. Parent education and parent-child interaction programs that are linguistically and culturally sensitive, for example, serving Hispanic populations. Access to child care assistance with provisions for quality and continuity of care. We certainly know that quality care is critical. Enrollment in programs that promote family economic stability and parents' participation in education or training that can help them move upward in the labor market. Prevention programs and services for children at risk for maltreatment and for their families. And then also access to health care and education programs for children who are cared for by their grandparents or by other relatives. And last slide. On accountability systems, I'd like to end with a reminder of how important it is for educators and policymakers to build, manage, and coordinate accountability systems. And just not saying this just as a researcher, but programs are finding that being data-driven and monitoring outcomes is really important. At the end of the day, having reliable data is the only way we can know what is working and what is not, and more importantly, know how to improve our programs that serve children and youth. Therefore, we need to evaluate the quality of learning environments, caregiver-child interaction, and teaching strategies. And this means collecting data for children and for their families, as well as assessing program elements and the workforce, in other words, the people who are providing the services for children and families. We also need to consider longitudinal linked data systems between programs and state agencies that can be disaggregated by risk factors. We often look at things in silos, and we really need to look at the development of children and the well-being of families across silos. We need early warning systems that can allow timely intervention. And we need professional development for data users, such as teachers, frontline workers, and administrators. We know these people don't necessarily get up in the morning to look at data the way researchers do. And so some professional development to help them become enthusiastic and effective users of data is another recommendation. Next slide. Thank you.
Thank you, Dr. Moore, very much. Let me remind you to all participants, you can submit your questions by using the question box at the bottom of your screen, and we will address these questions after we hear from Dr. Ron Haskins. Let me introduce our speaker, Dr. Ron Haskins from the Brookings Institution. He's the co-director of the Center on Children and Families, Budgeting for National Priorities, and Senior Fellow on Economic Studies. Dr. Haskins is a Senior Fellow, as I mentioned, and a senior consultant to the Annie E. Casey Foundation in Baltimore. From February to December of 2002, he was the senior advisor to the President for Welfare Policy at the White House. Prior to joining Brookings and Casey, he spent 14 years on the staff of the House Ways and Means Human Resources Subcommittee, first as Welfare Council's the Republican staff, then as Subcommittee's staff director. From 1981 to 1985, he was a senior researcher at the Frank Potter Graham Child Development Center at the University of North Carolina, Chapel Hill. He also taught and lectured on history and education at UNC Charlotte and developmental psychology at Duke University. Welcome, Dr. Haskins.
We ready?
We're ready,
Hello?
Dr. Haskins. Thank you.
Okay.
Yes,
Good.
go ahead.
Okay, good. Thank you. So I'm glad to be here. I always like to have the opportunity to talk to people who are policymakers or advise and work with policymakers. So this is a great opportunity for me, and I really enjoy it. I'm thankful I was invited. Can you change the slide, please? I want to start by saying that we've done two things in American social policy. One involved primarily and almost exclusively the federal level, and the other involved the states in a very important way, that have had the effect of reducing poverty. Chris already talked about one of these, and that is the decline in poverty among the elderly. The data you see in this slide go a little further back than Chris's data, so it shows much more of a decline. And very careful research at MIT and other places shows that this decline is due almost exclusively to Social Security. So we passed Social Security in 1935, we expanded it during the War on Poverty, and we expanded it several times since then. And by expanded, I mean not only covering more people, but increased the size of the benefit. And the research shows that that in itself is what reduced poverty among the elderly. So previously in human history, the elderly were the poorest because they can't work, or many of them can't work, but now they're much less likely to be poorer than children, which some of us think might not be the greatest thing that's ever happened, and especially since it comes almost exclusively from public dollars that we have had this decline in poverty. Now, Social Security has insurance principles. People pay into the system, as all of us do, and get money when we retire, but the money is not entirely from what we've saved. There is a kind of welfare element to the program as well, and it's progressive, so that people who have low income during their career are more likely to get everything out that they paid in plus more. So this is an effective thing. It shows you, here's an astounding conclusion, that if you give people money, they can escape poverty. We do some of that. We've done it at least since 1935, and before that, the states did it themselves, and individuals and churches and others gave things to people to get them out of poverty. But that's not very popular among the American public. They want people to earn their ways. So show the next slide. So in 1996, we passed legislation working with the states. The states were really the leaders here. And we passed legislation that required the states to have very strong work requirements. We can go in those later if anybody wants to ask questions about it. But the states aggressively implemented it. Many of the states, 41 to be exact, had actually started beforehand with waivers from the federal government and had started to change their cash welfare program, the Aid to Families with Dependent Children program, even before that program was reformed by the TANF, the Temporary Assistance for Needy Family Program. But if you look about the middle of this chart, you can see that the work rate among never married mothers, this is the poorest group, least likely to have good education, least likely to have a job, skyrocketed, increased by about 40% over a 4-year period following welfare reform. I hasten to point out there was a very good economy, so jobs were available, but we'd had good economies in the past, and nothing like this had ever happened to low-income mothers in the past. So it was a combination of a good economy and welfare reform, and the states stressing everything they could do to get people, and in this case about 90% of the mothers, in the workforce. And the result was, show the next slide, that we had a very substantial decline in child poverty among black children because they're so likely to live in single-parent families. About over 70% of black children are born outside marriage, and about half the others experience a divorce, so they're very likely to live in single-parent families. And children who live in female-headed families. And here's something to remember. If we can't reduce the poverty rate among children in female-headed families, we are not going to make progress against poverty. And the reason for that is children in female-headed families are 4 or 5 times as likely to be poor as children in married couple families. That family form, that is the children living with their mother without a father, is increasing rapidly and has been for at least 40 years. So we have to have a strategy that includes these mothers, as that welfare reform strategy did. Now let me tell you, it's hard to get mothers in the workforce. We've shown we could do it, but we had the advantage of a great economy. When we have an economy like the one we have now, it's more difficult. So I think we have to think of other ways to help get mothers in the workforce, and states have to assume responsibility for something that's very hard to do, and that is to create jobs. States did it during the recession. Some of you may recall that the federal government gave the states $5 billion and said you could use it to pay welfare benefits, or you could use it for one-time payments to help someone pay for a car so they wouldn't lose a car, or pay a housing payment so they wouldn't lose their housing. But they could also use it to subsidize jobs. And many of the states did it, and they subsidized a total of 260,000 jobs. I raise this because it's an example that even when the economy is not great, there are things that states can do of their own volition that will help low-income mothers be able to find jobs. And the second thing I want to point out, this is very important for policymakers. We also, over a period of years before welfare reform, and we've done some of this since then, we created what I call the work support system, And this is a system of programs that provide benefits to low-income working families. In the old days, back in the 60s and the 70s, many mothers who left welfare lost all their benefits. And they really had what amounts to negative incentive to actually leave welfare, because they lose all the welfare benefits and they couldn't earn very much money, and so they could be worse off by leaving welfare. But under the system that we have now, where we have very strong work supports through the Earned Income Tax Credit, through food stamps, which was reformed very substantially in 2002, so working families would be more likely to get their food stamps. We have more money for child care than we did in the past. But the Earned Income Tax Credit and the Child Tax Credit are the biggest benefits for these low-income moms. And they can't get it unless they work, and up to a certain amount, they actually get more if they work more. So there are very good incentives in the Earned Income Tax Credit, and altogether, when you put that money even with a low-income job, mothers are much better off than they are on welfare. You cannot escape welfare in almost any state you cannot escape poverty if you just are on welfare. So we have no choice if we want to fight poverty except to get people off welfare. So that's the second strategy, trying to figure out ways to get people off welfare and into the workforce, even if it's a low-wage job. And that also may entail for some states ways to think of generating jobs for mothers to occupy. Next slide. Now I want to make one point here that I think is very important. There are flaws in what I'm about to tell you. I'll tell you what those flaws are, but I still think this is really a major point. And that is what you see on this chart is what happens if people follow basic rules of citizenship, basic norms that are expected of people in American society. And the three in particular here are to complete high school, to work full-time, and to wait until age 21 and marry before having children. If individuals follow all three of those rules, as you can see on the bottom two charts, the dark blue shows that they have a 72% chance of living in the middle class. That is 3 times above the poverty level, and only a 2% chance of living in poverty. And if you look at individuals that don't follow any of those norms, then they have the numbers are almost reversed. They have a 4% chance of living in the middle class and a 77% chance of being poor. So I showed you this because our programs need to focus on getting individuals to show initiative on their own. That's exactly what welfare reform did. It gave mothers, first of all, it encouraged them to leave work. It helped them leave work. In some cases, it trained them. It trained them in how to interview for jobs and showed them how to look for jobs. And it also reinforced it. It made it advantageous for them to go to work. So it made the focus was trying to do everything possible to get individuals to fulfill their responsibility as citizens and the responsibility to their children. And it worked very well. That is the kind of thing that we need to look for. We need to look for ways to help individuals fulfill their own responsibilities. The flaw in these data is that they're correlational. Some of you may be familiar with research. Correlation is not causation. And that's certainly true in this case. It's a rule of social science that correlation is never causation. So you have really the only way in social science to know if something is causal is to do random assignment studies. And most of you probably know that we do have random assignment studies in these areas of the effects of education, the effects of marriage, and the effects of completing school and, in fact, even completing more education than just beyond high school. So under that circumstance, I think you're looking at something that's real, that the individual shows responsibility. If we can train them and show them how to show responsibility as they grow up, that we can have major impacts on the likelihood that they will be in poverty as adults. All right, now I would like to tell you about 2 things that are important right now in Washington, and both of them, if they were to be enacted, would have an impact on you. I frankly don't think anything is really going to happen. We're going to maintain the programs. There may be some cuts. As many of you know, there were cuts in Head Start, for example, but they were restored, and some of the other cuts were restored. But we are not living in an age when we increase welfare spending greatly over the next, I would say, at least decade. In fact, we have very good numbers now that show that we are spending less on children than we have in the past and more on the elderly. That was the implication in some of the charts that Chris showed you. That's something that we're going to have to focus on. This is not the time to talk about that, but I think everybody concerned with children should know that we are spending money that increases rapidly every year on the elderly, and we are actually cutting spending on children, and those trends will continue unless we figure out ways to spend not less on the elderly, but have the rate of spending increase at a lower rate than it does right now, and then we could finance children's programs. So the 2 ideas that especially Republicans are pushing in Washington right now, and I think there's at least some chance that they could be bipartisan, especially one of them. One of them is called the Flex Fund. This has been a policy that's been greatly discussed in Washington over the last 3 decades or so. And the basic idea is that the federal government does way too much. We should devolve a lot of authority and money to the states. Sometimes, especially when Republicans do this, they also cut the amount of money. So they give the responsibility to the states and cut the amount of money. In a way, that's what we did in welfare reform. We gave a block grant to the states but we did not have an inflationary increase, so really that money is declining in value every year. But at least the people who have talked about this, Rubio and Ryan, have talked about doing it in a deficit-neutral way, that we would give responsibility for various programs. The programs in question are food stamps, Medicaid, child care, housing, perhaps others, and we give responsibility for these programs to the state and let them do it however they want to do it and send them all the money, and it would increase each year under some rate. I say it would increase. That's the way people are talking about it now, but you never know once you start legislation that it would be possible to cut these programs, and that's something we really need to watch. We wouldn't want to do it, I don't think, if the states don't get all the money. But I think there's always a tendency in Washington to look for ways to devolve authority to the states. Republicans are more enthusiastic about that than Democrats, but I think we're going to go through another round of that. And then the second thing is an idea that Rubio also has discussed, and Ryan agrees with, and other leaders in the Republican Party, and that is to have a separate system, separate from welfare, for low-income working families, and to give them even more supports than we do now, to change the earned income tax credit so they get it monthly rather than once a year, and to make other changes so that the incentive to work is even greater than it is now. I think both of these ideas have some advantages. There are states that would take a deal like that because they really would like to have control over the program and be able to run them themselves without worrying about federal regulations. But as I say, I don't think these things will happen, but they're things that that I suggest that you think about. So that ends my presentation. I'd be glad to answer questions.
Thank you, Dr. Haskins, very much. As I mentioned earlier, Senator John Ungar from West Virginia was hoping to be with us today, but he is on the Senate floor working on Senate Bill 455, which he is sponsoring, titled Move to Improve, which is addressing children in poverty. And we'll certainly share more information to CSG's Knowledge Center as that continues to move forward. We do have an initial question for Dr. Moore. Dr. Moore, you talked some about integrated student supports. Can you share a little bit more and explain about the wraparound services that are available and how states can assist with that?
Certainly. Integrated student supports are actually a fairly common approach, but it takes many forms, and there isn't a specific set of services that are necessary, but there is a set of core components, and there are 5 of them. The first is a needs assessment, and a needs assessment means going in and figuring out what the issues are in that community. You know, is it teen pregnancy? Is it obesity? Is it drug use? What are the needs in that community? Second is the coordination of supports for students. Knowing what the needs are, supports are provided, and they are coordinated around the needs of a given student. Third is the integration of supports within the schools. Integration of supports within the schools refers to the notion that there's a professional working on the integrated student supports program, but they also work with the principal, with the teachers, with the school nurse, with the other people within the school so that you get over these silos. Integration, coordination, you could hear those words coming up again and again. The fourth core component is community partnerships. And the idea is that most schools don't have all the services and supports that children need, particularly kids with high needs, but that the community may have those, and so to locate those community resources and bring them to the children. And the fifth is data collection and tracking. The idea that not only is there an initial need assessment, but over time data are collected to make sure that supports are being delivered and that the outcomes that are intended are occurring. The whole purpose of this integrated student supports approach is to improve educational outcomes, but it differs from a lot of educational reforms, as you can tell from these 5 core components, in that it's not just focusing on educational inputs. It's looking at the child as a whole child and trying to meet their health needs, their behavioral needs, their emotional needs, so that they can be stronger students and go further in school. That helpful?
Thank you, Dr. Moore, very much. The next question is directed to Dr. Haskins. Dr. Haskins, can you tell us more about how all the stakeholders in a state, in addition to the state policymakers, such as business and industry, parents, community members, can all come together collaboratively to end child poverty?
It's a very difficult thing to do. For example, in our unemployment insurance system and the U.S. Employment Service, we have tried to have integrated programs forever, for years and years, decades now, and integrate the business community. They have to be on business representatives, have to be a majority on the workforce boards and so forth. And it has been somewhat successful, but not very. I am not optimistic that if we depend on coordination between numerous organizations that it's going to be possible to do. Now, it may be possible in some communities, but I think we need to be able to rely on our schools, on our welfare agencies, on the main institutions that we have delegated these responsibilities to. They should try to coordinate, but they shouldn't count on it working. They should figure out what their own goals are and pursue their goals aggressively.
Thank you. Can you expand a little bit more on how schools particularly can play a role?
Well, yes, I think the role of schools we've known for years and years and years, and we need to be able to focus on low-income kids, and they need to be able to increase their graduation rates and their literacy and their numeracy. Those are the basic problems that we have with low-income kids in this country. In fact, a recent study by the OECD in Europe of several, I think something like 25 nations, showed that the United States has among the poorest prepared workforce in the country. We're something like 17th, slightly below average in numeracy and literacy, focusing on measuring the kind of skills that are needed in today's workforce. So our schools are not producing kids who are able to move into an economy and get a decent job. And in fact, even perhaps more serious, many of them, especially the low-income kids, are not able to move into community colleges and other training opportunities because they lack the basic skills. So the schools need to focus on their own knitting. They need to make sure that they can actually teach reading, writing, history, and so forth to kids who begin with disadvantages. It's very important to realize, Chris said this, these kids began very substantially behind other children, substantially behind. But the schools make it even worse. They don't help them close that gap. So that's what the schools need to focus on, especially for low-income kids and kids with poverty in their background, that those are the ones that really need our help.
Thank you. This next question is for Dr. Moore. You mentioned a lot in your presentation about the need for data collection. So how can the state legislature in particular play a role in developing these robust data collection systems that you spoke of?
Sure. There are many levels in which data can be collected. One would be the warehousing of state-level data. For example, if you take a whole child perspective, you want to know about their education and their health, and yet those data systems are in many places still quite separate. And so you might want to find ways to combine those data and the child abuse and neglect data system, that you could have a more integrated sense of where kids are going, what services are getting, criminal justice. I mean, obviously there are huge issues around confidentiality, but they have been solved in many places. So that would be at the state level. I think also at the program level or the institutional level, it's really important to collect data on the individuals. And this is one of the strengths, I think, of the integrated student supports model, that it identifies the needs of kids. And the idea is not just the narrow needs in terms of education, but for example, do they need glasses in order to do well in school? Do they need to have their asthma addressed so they're not missing so much school? You know, these are sensible, cost-effective things to know and issues to resolve, and you need data to do that. And performance management systems are often still monitoring the services received. And we need to expand our use of performance management systems to monitor outcomes, because if all we're doing is tossing in services and we don't know whether or not they're producing the outcomes that we need, then we might be doing something that is useless or a waste of money, possibly something that's even harmful. So I think there's a role for data at the state level and also at the program level.
Thank you very much, Dr. Moore. And the final question that I have today is directed to both of our panelists. We're in the midst of 2014 legislative sessions. What would you say to state policymakers, specifically legislators, as they're underway with their education committees? What kind of questions would you ask them to seek out as they're working within their state to reduce the child poverty level?
Well, this is Chris Moore. I think that states need to recognize, I think they do recognize the importance of delaying childbearing, as Ron noted, up through at least age 21, and avoiding unplanned, unintended pregnancies, particularly among adolescents, but also during the early adulthood years. We know that these unplanned pregnancies to couples who are not committed to staying together and parenting a child are a source of children who face many challenges, including poverty. So I think being practical and encouraging delays in sexual activity, but also moving past that and helping adolescents and young adults know about contraception. I think this is part of the issue, is the arrival of the poverty population. After children are born, and no matter what we do, we will of course have children born into poverty, and we need to provide high quality services for them and really recognize the importance of the early years. Most of my work is actually among adolescents, but we all recognize that problems start in early childhood, and the high quality child care and early education are absolutely critical. Obviously, high quality schools to pick up children as they move forward in age is also critical.
I would say there are 5 things that I would focus on like a laser if I were in the state legislature and I want to do something about deficit child development and poverty. The first thing is I would support preschools. 40 of our states, or maybe 41 now, have preschool programs, and I think that's a very good thing. The states should do that. They should work like mad. The legislature should insist on cooperation between the various funds, streams of funding for preschool, especially the Child Care and Development Block Grant, Head Start, Early Head Start, and then the state pre-K program, which something like 40 states have. It's essential to get everything we can out of that money and don't let it be cut. Do everything possible to keep it from being cut. Preschool is very controversial nowadays, and there are a number of articles recently that have gotten a lot of attention. There have even been articles in the Wall Street Journal and other national media on both sides of the issue. But I still think that the strongest evidence that we have is that preschool can have an impact, but it has to be high quality. If you put kids in a regular kind of daycare or mediocre daycare that most kids are in, you're not going to get impacts on their development. It has to be high quality, which means good teachers, good training, all that. So a state needs to develop that for themselves within their own state, and that would be my first focus. The second one would be on the public schools, of course. It won't do any good to have great preschools if we have lousy public schools. So state legislators need to focus on the public schools, and above all, or maybe not above all, but at very high priority has to be on funding of inner city schools and schools that have a high ratio of low-income students. That we really fall down in that respect in the United States. We do have discrimination in funding of schools. The third thing is home visiting. Every state has home visiting programs, or a fair number of federal dollars as well as state dollars, and this would be especially good for really disadvantaged families and single mothers, mothers who have had a history of child abuse or neglect, mothers who have had children with disabilities. We should really help these mothers starting in the pregnancy and all the way until, say, age 3. These programs are fairly expensive, and we can't give them to everybody, but if we can figure out how to make maximum use of the dollars we have, that could make a big difference, especially with the most disadvantaged children. The fourth thing is I completely agree with Chris that we need to do more in preventing not just teen pregnancy, but in some respects even more pregnancy among 20-somethings. We made great progress against teen pregnancy, and this is the point. We've made it because we've spoken with one voice, we've told kids it's a bad idea, and we have brought them courses and other programs that focus not just on abstinence and on appropriate use of birth control, but also on getting them involved in community activities. I'd say all three of those activities are crucial, and we need programs that do that. And for the 20-somethings, we need free, for low-income families, above Medicaid, at least, $10, $15, $20,000 income above Medicaid, especially for single females. We need to help them get free long-acting reversible forms of contraception. That will make a tremendous difference. We have several studies now that show that. And then finally, I would say that data that Chris mentioned is really important. The states need good data systems. There's been a lot of progress in recent years. The most important thing, or one of the most important things, is we need to learn to integrate data from many systems so we can follow kids longitudinally and figure out the things in their background that helps them, so we can, social scientists like Chris can do studies and figure out the factors that really make a difference and help these kids. We've done work here recently at Brookings showing that a series of services as kids develop, focused on poor kids, can really make a big difference. It isn't like you give preschool and it's inoculation, everything's going to be fine. You need additional programs in the public school years and after they've left the public schools, just like the kinds of programs I described here. So there are a lot of things that state legislatures can do. I think states are ground zero in American social policy, and state legislators are probably the most important institution for an effective attack on poverty.
Thank you to you both. I really appreciate your comments. As I mentioned at the beginning of today's webinar, we are utilizing this webinar as part of our series with our 2014 CSG Leaders Initiative. We're excited about the opportunities for this coming year to focus on workforce and education, with particular emphasis on child poverty, food and nutrition, justice issues, as well as active duty military and veterans concerns. So we will be continuing our work this year. As Senator Unger will be chairing the subcommittee on child poverty. So we hope that you'll continue with CSG and look forward to the written products and other webinar series that we'll be having as the year concludes. It appears there are no more questions today. So on behalf of the Council of State Governments, I would like to thank you for joining us and participating in our webinar today. As I mentioned earlier, the audio portion and the slides will be on CSG's Knowledge Center sometime next week. Again, I want to thank you for being with us and want to extend a special thanks and appreciation to our panelists for sharing their expertise with us today. Good afternoon.